Concept 11. Sleep. Sleep is an essential component of life. The adequacy of sleep affects physiologic, psychological, and social functioning. Sufficient quality of sleep is crucial to metabolic regulation, cognitive functioning, quality of life, mood, and nearly every other aspect of existence. After this presentation, you'll be able to define and describe sleep. Notice risk factors that place individuals at risk for sleep problems. Recognize when an individual has problems with sleep and provide appropriate nursing and collaborative interventions to optimize sleep. People tend to think they have a good understanding of sleep, especially because everyone does it, and in fact, every living mammal engages in sleep. It does not seem very complicated to close your eyes and drift into a state detached from the busy day of wakefulness. Sleep is really quite complex, however, more so because the activities and events associated with sleep take place completely outside of individual awareness. Sleep is a relatively new field of study, and specialization and dictionary definitions do not match the prevailing state of science. The Oxford Dictionary of English, for example, presents a definition of sleep as a condition of body and mind such that which typically recurs for several hours every night, in which the nervous system is relatively inactive, the eyes closed, the postural muscles relaxed, and consciousness practically suspended. This definition is partially accurate, but it fails to acknowledge the essential processes that take place during sleep. Merriam-Webster presents a similar approach with the definition of sleep as the natural periodic suspension of consciousness during which the powers of the body are restored. All definitions have in common a change in consciousness that includes loss of awareness of the surrounding environment. More detailed definitions can be very specific about what is happening in the brain or in differentiating specific stages of sleep. For general purposes, the most important idea that sleep is natural, necessary, involves a shift in physiological and neurological activity, and is intended to be restored. Sleep occurs in a cyclic pattern following intermittent periods of wakefulness for the majority of humans. The time spent in sleep varies across individuals, as does the time of day during which sleep occurs. Despite such natural variation, there's a recurring need in all humans for a period of physical inactivity and a change in level of consciousness that allows for restoration and for a specific physiological mechanism to take place. For a variety of reasons, some people may not feel restored and refreshed after a period of sleep. This may be due to lifestyle or behavior patterns that prevent the individual from receiving the needed volume or quality of sleep. Lack of restorative sleep also may be indicative of a sleep disorder, which is a diagnosis of a specific pattern of sleep that is not compatible with the health needs of an individual. Thus, from a broad perspective, the scope of sleep ranges from restorative sleep that results in an individual feeling rested to impaired sleep, leaving the individual not feeling rested or refreshed. Impaired sleep can be intermittent or chronic, with chronic sleep being associated with physical, cognitive, and social challenges. Following a period of wakefulness, humans need to enter a period of rest and sleep that enables them to experience physiological restoration. Sleep occurs in stages and, under normal circumstances, in a fairly consistent pattern of movement through the stages. In general, the stages of sleep can be divided into two major categories: non-rapid eye movement, which is NREM, and rapid eye movement, which is REM sleep. In normal sleep, the individual proceeds through the 4 stages of NREM sleep, and then to the REM stage. Movement must be through all 4 stages before reaching REM. Each stage lasts generally from 5 to 15 minutes, and the entire cycle through all 4 stages plus REM typically takes 90 to 110 minutes. The duration of REM sleep gets progressively longer during the night, producing more deep sleep consistent with this state. This figure here shows the progression of the stages of sleep. In stage 1, or NREM stage 1, referred to as light sleep, the individual can be awakened easily. In this stage, brain waves slow, and on EEG, the slower wave pattern known as alpha waves appear. The individual at this point is likely to drift in and out of sleep and can be awakened easily. A common sensation of this type is the feeling of falling. They may have muscle jerks sometimes, and they can have sudden movements and startle that make them able to restore wakefulness. In stage 2, or N2, eye movement ceases. Brain waves become even slower, with the exception of an occasional burst or rapid brain waves. Pulse rate and respiration slow, and body temperature decreases as the individual moves towards deeper stages of sleep. Stage 3, N3, and stage 4, N4 are periods of deep sleep. N3 is characterized by very slow brain waves called delta waves, interspersed with smaller, faster waves. In N4, the EEG shows almost exclusively delta waves. In this type of sleep, it is difficult to awaken the individual, and muscle activity is very limited and may be completely absent. A person awakened from stage 3 or 4 of sleep can be disoriented for a brief period of time before gaining awareness. REM sleep commonly begins approximately 90 minutes after the onset of sleep. The first REM period may be rather short, sometimes lasting only 10 minutes. Periods of REM become progressively longer as the individual completes successive sleep cycles. And the final period of REM may last as long as 1 hour. EEGs of REM sleep show patterns of brain activity that are very similar to those produced when an individual is awake. In individuals who have normal sleep patterns, no sleep disorder, cardiac and respiratory rates increase and become uneven, and rapid eye movements for which this stage is named takes place. This also is the stage of active dreaming related to the increase in brain activity. Although the brain is more active, there is also an increase in brain activity. Although the brain is more active, there is a form of muscular paralysis that prevents the individual in normal circumstances from engaging in movement or other action that could be very dangerous given the activity of the brain at this time. Deep sleep is essential for the body to accomplish important restorative processes. Not only does such restoration contribute to wakefulness and alertness during non-sleeping hours, but also the body undertakes a number of important physical processes. These include tissue regeneration, bone and muscle development, and immune enhancement. Regulation of body metabolism and fat deposition also are affected by the depth and duration of deep sleep. Other hormones associated with sleep and essential for health include cortisol, human growth hormone, leptin, and ghrelin, the hormones that regulate appetite and body fat disposition. Sex and reproductive hormones are also affected by sleep and include secretion of testosterone and hormones associated with fertility, follicle-stimulating hormone, and luteinizing hormone. An increase in the hormone melatonin at the onset of sleep helps to promote and maintain sleep, and a decrease in level leads to eventual awakening. The immune system is enhanced as well during sleep, as proteins associated with fighting illnesses are produced. The circadian rhythm, or the typical 24-hour cycle through which the body passes, including both wake and sleep cycles, is responsible for regulating all of the physiological processes in the body. An adequate amount and quality of sleep, therefore, is essential to all the regulatory mechanisms that take place in the body. The amount of sleep typically needed by people in the age group as follows. For infants, they need about 14 to 16 hours a day, which is why they tend to sleep a lot when they're first born. Toddlers need about 9 to 10 hours at night in addition to about 2 or 3 hours of daytime naps. School-age children need about 9 to 11 hours. Teenagers need about 9 hours of sleep. Adults need about 7 to 9 hours. It's important to remember that these are general recommendations and some variations will occur. Although the amount of sleep needed by each individual varies, research has shown that those who claim they function well on minimal sleep actually respond to tests in a manner consistent with someone who is sleep deprived. Many variations in sleep are the result of controllable phenomena. Personal choices about bedtime, dietary habits, ingestion of alcohol or stimulants, frequent napping, and so on. The environment in which someone sleeps can lead to poor sleep quality as well. Caregiving responsibilities such as ill or elderly housemates or infants and children with interrupted sleep patterns can affect the sleep of others in the vicinity. Work and job responsibilities may result in poor sleep due to fragmentation as a result of working more than one job or problems associated with shift work. Any of these can result in a substantial disturbance in sleep. Situational challenges such as worry or stress can also contribute to periodic episodes of ineffective sleep. In such situations, it is common for an individual to have difficulty falling asleep or remaining asleep. Waking several times during the night to deal with worries or stress easily can lead to ineffective sleep. Most people experience ineffective sleep at some or multiple points in their lives. When the problem is recurrent or ongoing, the individual may be said to have a sleep disorder. Now let's talk a little bit about sleep disorders. They kind of break them down into two different types: primary sleep disorders and secondary sleep disorders. Many individuals who have sleep disorders defined in the accordance of the existing diagnostic standards are those set by the American Academy of Sleep Medicine. Variations in sleep can occur along several different dimensions. They may be inefficient time spent sleeping or poor quality of sleep despite adequate time, problems falling or staying asleep, intermittent or situational disturbances in sleep, and any number of situations that result in a lack of feeling rested or refreshed. So these primary sleep disorders are those that exist as an independent condition. That most common categories of primary disorders include insomnia, sleep-related breathing disorders, sleep-related movement disorders, parasomnias, circadian rhythm sleep disorders, and hypersomnia. Insomnia exists when there is difficulty falling asleep or staying asleep. Sleep-related breathing disorders involve either a problem with the airway, or as seen in obstructive sleep apnea, or a problem with the neurologic drive to breathe during sleep, and this is known as central sleep apnea. Sleep-related movement disorders include restless leg syndrome or periodic limb movement disorder. Parasomnias include a variety of behaviors such as sleepwalking, sleep tears, or REM behavior disorders. Circadian rhythm sleep disorders occur when the drive to sleep does not occur according to what would be considered a normal sleep-wake pattern, such as someone who stays awake until early morning and does not have the drive to fall asleep as nighttime progresses. Hypersomnia is characterized by excessive sleepiness or falling asleep at inappropriate times. Narcolepsy is an example of hypersomnia as a primary sleep disorder. Secondary sleep disorders are sleep disorders that occur as a result of other situations, and correcting that disorder would resolve that problem with sleep. Secondary disorders are often caused by medical conditions, mental health conditions, or side effects of mental treatments. Some of these medical conditions can be like Alzheimer's, anxieties, arthritis, asthma, cancer, chronic obstructive lung disease, depression, epilepsy, fibromyalgia, acid reflux. And a secondary sleep disorder may be associated with the use of a medication that has either a sedative or a stimulating effect, because either of these actions can interfere with restorative sleep. Prematurity in infants may also lead to problems with sleep secondary to the state of a neurologic or cardiovascular development. So now let's kind of talk about some consequences for sleep problems. So excessive daytime sleepiness is a very distressing side effect of inefficient or poor quality sleep. In addition to the psychological and emotional challenge of sleepiness, the physiological consequences of poor sleep are widespread and can be serious. When sleep is inadequate, a large number of basic regulatory mechanisms of the body do not function effectively. Commonly occurring physiological consequences of poor sleep include hypertension, heart disease, heart failure, stroke, obesity, and developmental disorders may be related to physiological factors such as alteration in growth hormone. Reproductive disorders can occur due to disruption in hormone regulation. Mortality has increased significantly for people who report less than 6 or 7 hours of sleep per night. And studies have shown that sleep is a greater risk factor for mortality than smoking, high blood pressure, and heart disease. Sleep apnea particularly increases the risk for metabolic syndrome, diabetes, hypertension, and heart disease, and it has been identified as a potential causative factor for these conditions. Research has revealed that common stereotype of individuals having sleep apnea because of obesity is not accurate, and that the obesity may actually be the outcome. Sleep, therefore, is essential to effective weight management, and anything that diminishes the amount or quality of sleep can have significant consequences. Immune function also is diminished in cases of inadequate sleep. Sleep is essential for all of the body's physiological mechanisms, so results of poor sleep are widespread and significant. It is quite common clinically to see individuals with multiple health problems, including diabetes, heart disease, and hypertension, who have a sleep disorder as a potential causative or aggravating factor in the physical problems. In children, poor sleep quality or inefficient sleep may be manifested primarily by development or behavioral abnormalities that may be physiologic components as well to poor sleep. So now let's take a look at risk factors for sleep problems. Every human being is at risk for sleep problems. Although the risk for sleep problems is widespread, several known factors place an individual or group at greater risk. Although risk factors are not easily generalized because some risk factors are unique for specific sleep problems, assessment of sleep can be made easier by recognizing common risk factors associated with various conditions. So let's kind of talk about the populations at risk. So as a population, middle-aged and older individuals are at greater risk for nearly all adult sleep disorders. So this is when we start looking at the hormone changes, the changes in routine and lifestyle with advancing age, and the development of medical conditions. And all of these are common because as people tend to get a little bit older, they start having, some they become more at risk for health conditions. Also, women tend to be at greater risk for developing some sleep disorders, and these can be like insomnia, restless leg syndrome. Pregnant and perimenopausal women often experience sleep disturbances as a result of these hormone fluctuations that can disrupt sleep, maybe because they're having night sweats, which then these symptoms lead to insomnia. Pregnant women also have additional challenges of changes in body shape that can create discomfort, difficulty breathing when they lay down. Also, men are at higher risk for developing obstructive sleep apnea than women until menopause, at which that point women, their risk is they increase. African Americans, Hispanics, and Pacific Islanders are actually at greater risk for obstructive sleep apnea than Caucasian population, and children have a greater risk of obstructive sleep apnea than the general population, primarily because of their tonsil enlargement. Obesity can increase your risk for obstructive sleep apnea in children as well. So then we start looking at we'll start looking at individual risk factors in the next slide. The most notable individual risk factors are related to family history, individual behaviors, and underlying condition. So family history is a significant factor in the occurrence for most sleep disorders, including obstructive sleep apnea, narcolepsy, and insomnia. The nurse is not likely to have this information. However, unless a thorough history is obtained, the completion of a thorough history is complicated by the fact that it is quite common for people to not know that a family member did, in fact, have a sleep disorder. So it's important that we, assess and ask questions. And if someone is complaining of fatigue or sleep disturbances, that we complete a thorough family history as best as possible, of course. Not everyone's able to know their family history or know or have ever asked about sleep disturbances. So individual behaviors. So individuals who work like variable shifts, particularly involving night shifts, are at risk for ineffective sleep and sleep disorders, especially if they try to maintain a typical day period of wakefulness on days they are not working. They are also at risk for sleep disorders for those who work very long hours and monotonous routines as truck drivers, right? They're trying to stay awake for long periods of time. They can get very sleepy. So individuals who've undergone recent life changes or experiencing increased stress are at high risk for sleep problems, especially insomnia, or those who have irregular daily routines often experience problems with inadequate sleep or poor sleep quality. And the idea that it's possible to catch up is believed by many. But research shows, however, that such attempts to catch up are not effective and do not compensate for poor sleep at other times. Things like drugs and alcohol, dietary behavior, or like watching TV or disturbance from light or a partner in bed, child care, these all contribute to having poor sleep hygiene or experiencing inefficient or poor quality sleep. And finally is underlying medical condition. A significant risk for ineffective sleep is having one or more underlying medical condition and pharmaceutical agent used to treat medical conditions that interfere with sleep or the treatment for those conditions that interfere with sleep. Symptoms that commonly interfere with sleep include pain, problems breathing, and anxiety. So people that have medical conditions that interfere with sleep, can affect the quality of sleep. Although assessment of sleep is a component of health assessment, this is not addressed consistently by healthcare personnel. Practitioners do not always ask patients about sleep, and when concerns are discussed, clinicians may have difficulty differentiating fatigue or tiredness from sleepiness. In view of importance of sleep to overall health, nurses should incorporate sleep assessment with all patients with whom they interact to determine if individuals are getting sufficient restorative sleep. To begin, we'll start by asking the individual how he or she feels upon awakening. Ideally, the person awakens feeling rested and refreshed. Any response that is different indicates less than ideal sleep. The individual may not feel rested and refreshed on awakening, lack of energy to do things he or she enjoys, or feel less productive at work. These statements like this, indicating weakness, malaise, lack of appetite, and so on, may accompany reports of fatigue. Then we'll need to ask additional questions. We need to ask questions like, what happened while trying to sleep should come next. If the individual reports difficulty sleeping, assessment should include a discussion on what happens when the individual tries to sleep. When we ask questions like, we'll need to ask questions, for example, like, are you having racing thoughts? Is there any discomfort that's preventing you to sleep? Does the individual feel safe while sleeping? Does the individual awaken during the night or awaken early in the morning? And you need to kind of like dig in. When you ask that kind of question, you kind of lead into the next. Like, what awakens him or her? Like, maybe you can find out, maybe they have a really big window and the light comes in, so awakens them. And maybe you can fix that. There'll be something simple and you can fix it like with blackout curtains. Inquire about the sleeping environment, including bedroom and comfort factors such as light and temperature, like I just said. if we start specifying the inquiry regarding physical symptoms, then we can start addressing like discomfort or need to urinate that may need to awakening. Because then we can start looking at other symptoms such as like headache, dry mouth, nasal stuffiness, and then you're requiring, additionally like worries and concerns. Um, can can this person return to sleep quickly after being awakening? And so as you're asking these questions, you can, it kind of sets up like the next question, like what the next question would be. A detailed history of sleep behavior prior to sleep is key in determining whether or not a sleep problem exists and what the nature of that problem might be. As fatigue is an extremely common symptom of impaired sleep, and in many cases the case that causes behavioral and origin. Maybe this person stays up too late during the week, maybe they watch TV, maybe they play on their phone, maybe they use medications, whatever it may be. We need to kind of review these behaviors with them, and maybe it could be something simple and we can address that with them. A thorough review of symptoms is important, or systems is important to identify problems that might indicate an underlying sleep disorder, such as pins and needle feelings in the leg, or pain or nocturnal urination that disrupt the pattern of sleep, headache, respiratory problems, or dry mouth or sore throat, heartburn or acid reflux, or a feeling of the heart beating either very fast or irregularly, pins and needle feelings, or pain in the body are all possible findings on the history and review that may be indicative of a sleep disorder. Again, family history is significant because there's a strong familiar predisposition for most of the sleep disorders. And then we go into the assessment. Relatively, again, few physical findings directly indicate a sleep disorder. However, sleep disorders are more common in people with upper airway or craniofacial construction that lead to more easily obstructed upper airway. And then we can start looking at, physical examination of respiratory and cardiac function is helpful because, these conditions can be associated with sleep disorders. Cardiac function and coloration can indicate oxygen status and can alert the nurse to possible sleep problems. Any neurologic changes can also impact sleep quality. And then there's also diagnostic tests. So a variety of tests can be conducted that might identify conditions that have occurred as a result of sleep problems. The only definitive tests for sleep problems are those that measure activity and events related to sleep and wakefulness. These are most commonly done after you go see a sleep specialist and they give you a referral. So the polysonogram is one of the most important tests to identify sleep disorders. So it's a polysonogram, or a PSG. A PSG is conducted while an individual sleeps and include monitoring of an array of physical parameters. They can be used to evaluate a variety of sleep disorders, including difficulty falling asleep, difficulty staying awake, and sleep-related breathing disorders. They're conducted using an array of electrode and monitoring devices that can vary depending on the specific reason for conducting the study. What they do is they put a bunch of EEG electrodes on the head. They put like a belt across your chest, and that will help measure. They put cardiac leads on to measure your heart. They put a belt across your chest to measure your respirations. They put some electrodes as well on your legs, and that'll also monitor for like restless leg syndrome. And they monitor your movement and position, and they also have like a video monitoring. And so basically they watch you sleep, and then they'll monitor your pulse ox. And if your pulse ox is dropping, then they may come in and put you on CPAP, because they are noticing that you have obstructive sleep apnea. And so typically you spend about 8 hours there. And then they're able to determine if you have any sleep-related breathing problems or anything there. You can also keep a sleep journal. Other means of data collection are to help in the diagnosis of sleep problems, and these are kind of, again, subjective in nature, particularly the maintenance of a sleep journal. Individuals may be asked to record a summary of their daily activities, Dietary intake, bedtime, discussion of what happened during the night and time awakening, subjective assessment on awakening, such as whether or not the individual feels refreshed or restored on awakening. It can be important adjunct to other means of measuring and assessing sleep. And again, once again, these are all subjective. This sleep journal is subjective, but it'd be pretty nice to have this sleep journal for a patient, because when you come in and you're trying to give like a whole month, or well, I felt pretty good on this day, but I didn't feel good for this week, you can just open up the journal and give a presentation of a review of how the patient felt. Clinical management of sleep problems varies with the nature and type of the problem or disorder. So clinical management is broken down into like two types: primary prevention and secondary prevention or screening. So primary prevention is basically like sleep hygiene. Sleep hygiene includes attention to the environment for sleep and to personal behavior. The sleeping environment should be comfortable, well ventilated, quiet, and as dark as possible. The optimal temperature is kind of keeping the room cool, not too cold, but not too warm either. That can temperature can interfere in sleep quality. The bed should only be used for sleep and sexual activity. The bedding and blankets should be evaluated along with other factors of the environment to determine if something in the bed or environment overall is affecting the quality of sleep. Personal behaviors and habits are widespread causes of sleep problems, like a lack of time spent in sleep often contributes to daytime sleepiness. So really, it's working on things to improve your sleep, So really, it's about establishing good sleep hygiene. They'll work on establishing the healthiest pattern to have a consistent bedtime and awake time, and so adhering to that pattern. And if somebody does need a nap, like sticking to a very short nap at the same time every day of like 30 minutes or so, I guess considering it more like that power nap that you may hear of. And the individual therefore the individual should have no problem falling asleep. And then watching out for your dietary habits. So if this person is one to suffer from like acid reflux or something like that, they preventing like overfeeding and stuff like that might affect somebody from staying asleep at night. They would particularly avoid any alcohol or stimulants, and avoiding any heavy meals, spicy foods, sugar foods before bedtime, and then therefore also setting up a regular exercise program. And all of this would be done as to getting and establishing a healthy sleep program. They would not be using we would be encouraging, discouraging the use of any over-the-counter sleep products that could interfere in messing up their new set-up sleep patterns. The secondary prevention or screening program would be, they have a number of instruments or screening products. The American Academy of Sleep Medicine has a screening tool that addresses a variety of sleep problems. Selected aspects of the tool can be adopted and used for screening as appropriate to the population, and the screening reveals the aspects of sleep that we're wanting to focus on. And then, of course, other organizations focus on sleep, along with a number of clinical agencies have developed their own screening tools for use in assessing sleep quality in the presence of sleep problems or specific to the population in which they work with. So you really want to focus on asking those appropriate lifestyle and behavior factors that might be contributing to their sleep issue. A number of concepts are related to sleep through their essential role in healthy sleep patterns. The number of concepts that are related to sleep is quite extensive. The concepts of greatest concern in discussing sleep directly are presented in this figure. Perfusion and gas exchange are shown with bidirectional arrows in this figure because poor perfusion can cause problems sleeping, and poor sleep exacerbates many cardiac and respiratory conditions such as coronary artery disease, chronic obstructive pulmonary disease, and asthma. Cognition is also shown with the bidirectional arrow because many individuals with impaired cognition experience sleep disturbances, and impaired sleep can affect cognitive function. Individuals experiencing pain often have problems sleeping unless the pain can be adequately managed. Changes in hormonal regulation, such as increased thyroid secretion, can alter stages of sleep. The altered sleep can affect hormone regulation. Problems with elimination are known to be disruptive to sleep, particularly in adults. Enuresis, bedwetting, is an example of a childhood sleep dysfunction. Fatigue is an extremely common outcome complaint associated with impaired sleep. The most common conditions encountered in regard to sleep are complaints of insomnia, obstructive sleep apnea, and general tiredness. The term insomnia refers to the inability to fall asleep or stay asleep and can last a few days or can occur over time. Insomnia can be associated with a number of conditions, including acute stress, pain, depression, and underlying medical conditions. It can occur as a result of drug or alcohol use also. Jet lag, shift work, sleeping disorders. The most common circadian rhythm sleep disorders occurs among individuals who work variable shifts and for those who do extensive travel. This condition is characterized by disruption in the sleep-wake cycle, thus affecting the individual's ability to sleep. For those who travel across time zones, the term jet lag is often used because the individual's body time is not synchronized with the environment time, thus affecting the sleep-wake cycle. There is a direct correlation between the severity of symptoms and the number of time zones crossed. Narcolepsy. Narcolepsy is a poorly understood chronic neurological disorder caused by the deficiency of a neuropeptide that results in the inability of the brain to properly regulate sleep and wake cycles. This condition is most common among adults and is characterized by overwhelming daytime sleepiness. Individuals with this condition often find it difficult to stay awake for long periods of time, and they may experience brief periods of falling asleep throughout the day. This condition can lead to poor school and work performance, creating significant challenges, including reduction in functional ability. Obstructive sleep apnea. Obstructive sleep apnea is a condition characterized by interruption of sleep due to temporary airway obstruction by the soft palate, base of the tongue, or both. These structures collapse against the pharyngeal walls due to reduced muscle tone during sleep. The episodes lasting up to 30 seconds result in decreased oxygen saturation and fragmented sleep. A person with obstructive sleep apnea typically will describe being extremely tired despite having spent sufficient time in bed. Other symptoms include heavy snoring, chronic daytime sleepiness, fatigue, sore throat, and headache on awakening may also be reported. Obesity hypoventilation syndrome. Obesity hyperventilation syndrome, OHS, one of the most severe forms of sleep-disordered breathing, is characterized by poor gas exchange, resulting in reduced oxygen and increased carbon dioxide levels in the blood during sleep. Although the exact cause is unknown, OHS is thought to be caused by impaired respiratory mechanics due to excessive weight against the chest wall and depressed respiratory control during sleep. Most individuals with OHS are overweight or obese and often have a short, thick neck. Common symptoms include report of poor sleep quality, daytime sleepiness, fatigue, and headaches. Somnambulism. The common term for somnambulism is sleepwalking. This condition occurs most frequently among children, especially school-age children, but can occur among adults as well. Somnambulism is characterized by getting out of bed and doing an activity in partial wakefulness state during normal rapid eye movement sleep. The activity is often goal-directed and can range from getting up in bed to walking around the house, moving objects, and even driving a car with no recall of the event on awakening. Sleep terrors. Sleep terrors, also known as night terrors, are a parasomnia characterized by sudden episodes of intense fear, screaming, panic, and confusion while still asleep. The episode can last from just a few seconds to several minutes. There is usually increased respiratory rate, heart rate, dilated pupils, and diaphoresis. Night terrors are not associated with dreams during REM sleep, and there is usually no recall of awakening. Night terrors occur most often during early to middle childhood, although they can occur among adults, particularly those under significant stress or associated with substance abuse. Question 1. The nurse is discussing the concept of sleep with the student nurse. Which statement made by the student nurse is incorrect and warrants further discussion? The answer is 4. Fatigue is always caused by sleep disorder. Question 2. Lab is attempting to wake a patient to draw blood. The patient is difficult to arouse and upon wakening is disoriented for a brief period. The patient was likely in which stage of sleep? The answer is 4. N4. Thank you for joining me for Concept 11, Sleep. If you have any additional questions, please reach out to your instructor. Thank you.